Morning, everyone, and welcome. My name is Jeremy Norton Paul, and I'm the Executive Director of the Washington State Developmental Disabilities Council. And just real briefly, for those who might not be familiar with us, we have a very important federal mandate to advocate with and on behalf of people with developmental disabilities and their families across Washington State. And we have governor-appointed members who represent their various regions of the state, all the way from Colville to Vancouver and lots of places in between. Thank you so much for joining us, for being here this morning for a very important conversation about special education during COVID-19. We're very, very pleased to be joined by State Superintendent of Public Instruction, Chris Rakedal, and also Assistant Superintendent for Special Education, Glenna Gallo. I'm going to share with you a few notes about what to expect during this webinar, and then we'll get right into things so we have as much time as possible. So first, a few technical notes about the webinar. We have been speaking with lots of folks about how to make this experience as accessible as possible, and we have learned so much over the last few months during the pandemic about creating accessible virtual spaces. By no means do we have it perfectly figured it out yet, but we are implementing several strategies today, and of course, always welcome feedback so we can continue strengthening the way that we do things. So first, this webinar is being recorded and will be posted online tomorrow on the DD Council and Arc of Washington State websites. We're also live streaming to Facebook from the Arc of Washington State's page. And not only does that increase the number of people who can participate, but it's also an accessible platform for those who prefer it over Zoom. In terms of captioning, if you're live streaming this on Facebook, there will be a link in the comment section that you can click on in order to get live transcription. So if everyone would just hold off on commenting or liking the stream for just a minute, we'll get that link placed there now. And if you're viewing this through Zoom, there will be a link that we share in the chat box that you can click to get the live transcription. We've also arranged for an American Sign Language ASL interpreter who you should be able to see on the video screen. And when we post the final recording, there will be a written transcript that goes along with it. And just to make sure that everyone on here can see the ASL interpreter and the presenters and the content that we're sharing, Stacy and I and the other presenters are going to keep our video off for the majority of the time unless we're actively speaking. And so we'll ask our presenters to do that as well. This webinar does have a chat box feature that you can use to introduce yourself, like many of you have already done, or let us know if you're experiencing any technological issues that will hopefully help you sort out. If you have questions specifically for our presenters, please use the Q&A, the question and answer box for that, and that will allow us to help us keep track of them more easily. And if you're unable to type your question into the Q&A box, there's also a button that you can use to raise your hand virtually. And when we get to the question portion, we'll do our best to get to you to ask your question verbally. And just one more quick note before I hand it over to Stacy. This is an extremely important topic and very timely, and one that we know is extremely personal for thousands of families across the state, including many of you on this call. On top of the pandemic and the looming state budget crisis, families are just so worried about what school is going to look like and how their kids are going to get the education they need. Today is a good opportunity to hear directly from OSPI leadership and also directly from families who are experiencing challenges. So our hope is we can all listen empathetically to each other and respect the courage it takes to express views so publicly on such a complicated and emotionally charged topic. So thank you for helping us to create that space. And with that, I'm going to hand it over to Stacy Dim.
Hi, everybody. Thank you again. I'm very excited for today. I'm Stacy Dim, and I'm the Executive Director of the Arc of Washington State. The Arc is a national organization, as many of you know, that promotes and protects the human and civil rights of people with intellectual and developmental disabilities, ensuring their right to a full inclusion and participation in all aspects of society. We have 8 local county chapters here in Washington, and we've been around since 1936. The ARC is known for pioneering innovative programs and services, encouraging progressive governmental, sorry, that's a hard word today, policies that promote independence, self-sufficiency, and inclusion. We're also regularly informing and educating people on the inherent value of individuals with intellectual and developmental disabilities. And today, I'm so grateful to welcome our 2 guests today, Superintendent Chris Rakedal and Assistant Superintendent for Special Education, Glenna Gallo. We're here today to talk about students with disabilities and how we can ensure that they're getting access to a free and appropriate public education during this difficult time of COVID-19. I know that this is an emotional topic and so personal for so very many families. And I just wanted to take a brief moment to recognize that we are knee deep in a pandemic and we're struggling in so many ways. So many of us have experienced COVID ourselves, or we've lost someone to COVID, and many of us are grieving. And there's also so many parents that are anxious about whether they can return to work, how they can live and manage their lives without the usual routines and rituals and the social environment of school for their children. Glenna and Chris, if you could go ahead and turn on your cameras. I know that you're both living and breathing this yourselves, and welcome onto the camera. I wanted to give each of you just a moment to introduce yourselves and check in with us on how things are going. We're going to spend a few minutes doing this, and then I'm going to present a couple of slides, and we have 5 parent speakers, and in some cases they're students, here to share their stories. And then after that, we'll have some questions and answers. So Superintendent Rakedal, I know that you have school-age children yourself, and many of the decisions you're making on behalf of our state are personal for you too. And Assistant Superintendent Gallo, I know you have someone in your life who's college age and navigating the reopening of universities and college campuses. So we know that, again, this is personal for you. Superintendent Rakedal, I wonder if you'd just check in with us for a couple of minutes and share a few words as we get started.
Great, thank you, and welcome everybody. For every difficult and dark cloud, there's always a silver lining, and I think part of it is that we're all getting better at utilizing tools like this to have conversations around the state. I see some folks out of state here. We've got students and prospective educators, a lot of parents here today. So I want to thank you for being a part of this. It is a really powerful moment for us, and as you heard from those introducing the conversation, it's obviously a really difficult time for folks across the country, in our state in particular. We were one of those first ones hit really hard, and while we had tremendous success in the months of April and May, bringing our caseloads down, our hospitalizations down, and candidly our mortality rate down, things really started bouncing back in June, quite aggressively by the end of June and all through the month of July. So where we find ourselves now, of course, is school districts making really hard choices about how to deliver supports and services to their students, almost all remotely. Roughly 90% of our students at this point will start school remotely based on the health criteria that the governor and the Department of Health laid out a week and a half or so ago. That's really about being in a high, medium, or low risk county based on your cases per 100,000 population over a 14-day period of time. We do have some districts trying to start in hybrid models, and just a handful, maybe 6 or 7 very small remote districts who believe they can successfully open fully in a face-to-face model. We'll make sure Glenna gets a chance to introduce herself a bit here, but as a larger sort of message, I just want to say thank you for the compassion around the work and the understanding, and also really pushing, because I think what we're always grappling with here is the guidance from the governor and the Department of Health is really driving the health perspective on this, the epidemiology and what schools really should and shouldn't do from an opening standpoint. We have a personal responsibility here, a professional legal responsibility to really uphold the power and civil rights components of FAPE. And so we take that very seriously, and many of you have interacted with our office in that way. As most of you know, we are a local control state, so the deployment of all of these decisions, the development of IEPs, the development of supports in a face-to-face or remote model, the partnerships in community, all of that stuff that you navigate as families and parents and students is in a relationship with school districts, and it's very personal, it's very localized. And really we try to enforce the expectations, the flow of money where it's appropriate. And of course, we have a review process on the back end and have the ability to take actions when we think a district is not complying with federal and state law in this space. So I do want to make sure we introduce this, really hard and sometimes emotional topic of where can the state really create leverage for outcomes and supports, and where does this really fall on local school districts to deliver the details of it, and then how does that process come together when it's not working well. So I want to thank you and look forward to the question and answer period. And I'll turn it over to Glenna, and she can give you a little bit of her background and the role she has here.
Great, thank you so much, Superintendent. I'm Glenna Gallo, Assistant Superintendent of Special Ed here at OSPI. This has been a learning experience for us all, whether we're professional educators, we're parents, we're administrators, or leading these changes. And I appreciate the conversations that I've had with many of you regarding your needs, the needs of your students, questions that you have about how to safely provide special ed services, the need to make sure that students receive a free, appropriate public education, or FAPE, and then how it is that we kind of take these issues on a case-by-case basis and make sure that decisions are made that are safe for everyone involved, and then lead to the best outcomes that we can for student learning. With that, Stacy's already said, I'm a parent of a college-age daughter, one who's already out of college, and she is in her final year of becoming a special ed teacher. So this has been very close to home, not only on working on behalf of students and thinking about the needs of parents, but also thinking about how it is we prepare our workforce, those who are in place, as well as those who are going through educator prep programs to teach in this new delivery system. Well, it's new to many of them. And so we're excited to have this conversation with you and to share with you the same information and guidance that we've been putting out, that's posted on the OSPI website, that we've been putting out by emails and phone calls, and then conversations that we've had with local districts also. So we're looking forward to this conversation.
Great, thank you so much, both Chris and Glenna. Just to get us started, I have just a couple of slides that I was going to review, and I'm going to take my camera off so that that's as big as possible for people who are watching. So before the pandemic hit, as I know you're both very aware, we were facing some pretty significant inequities and disparities in public education for students with disabilities. With COVID, the closure of schools, continuous learning plans, remote learning, the lack of in-person instruction, and lack of access to therapies and routines, it's really disproportionately impacted our students and highlighted some of the inequities. For many of you that may not know, we have almost 140,000 students with disabilities, age 5 to 21 in our state. And OSPI provides assistance and support to over 300 school districts, tribal schools, and charter schools. It's estimated that over 13.5% of all students in our schools have disabilities. And we know that number can go higher depending on how you define disability. In our state, we have been challenged even before the pandemic. Only 50% of our students with disabilities were included in general ed settings for 80 to 100% of the time. And Washington is currently one of the least inclusive states, ranking 44 out of 50. And I know that is something that's heavy on your mind, Glenna, and that the state is working on projects to improve those figures. We also know that the disciplinary rate of students with disabilities is 2.5 times higher than for students without disabilities, and that the rates of restraint and isolation are disproportionately affecting students with disabilities in every district. And that we have 4 out of 10 students with disabilities reporting being bullied or harassed in school. So some of those issues are certainly challenging us. And as we move into what we're going to do next with COVID, and if you could advance to the next slide.
Actually, Stacy, right before you do that, I'm so sorry to interrupt. I just wanted to address, this is Jeremy Norton Paul. We've seen a lot of comments asking about the link for the captioning. And we had a very last minute change with the captioning and interpreting setup. And I'm so sorry to ask this, but Crystal, do you have a link that you can share with us for the live captioning? We were told that would be provided.
I think it might be Brian who would have the link.
Brian?
And it's the well-type link.
Okay. Great. And so as soon as we have that link from Brian or Crystal, we'll get that pasted into the chat box. Apologize for the interruption.
Oh, it's okay. That's important. Thank you. And so, Greer, if you could advance to the next slide, that would be great. So what we know is that some services really simply can't be easily replicated at home or remotely. For students in particular with significant communication and behavioral, intellectual challenges, for students that need significant instructional support, they're at some of the highest risk for regression and family crisis without effective educational services. We have families who once had partners in teachers, paraprofessionals, school psychologists, speech therapists, OTs, PTs, behavioral support specialists, and access to assistive technology. And honestly, they're feeling a little abandoned and lost without that extra support. I hope that we can agree that there's some very unique and pressing challenges faced by students with disabilities. But I also want to point out that doing the same thing for all students can be discriminatory for students with disabilities. And so equal is definitely not equitable in so many ways for our students. And so we know that there are going to be some pretty significant challenges that you face as OSPI supporting our districts, and that districts are going to face in trying to work with families. So to highlight some of these challenges and personal experiences, we do have 5 parent speakers, and in some cases their student, to share their stories. And I'm going to turn it over to Jeremy now to introduce them.
Yes, thank you, Stacy, so much. And I just wanted to acknowledge again that we are working through some technical issues. The link for the captioning has been pasted into the chat box, and so you can follow that if you need it. And we have heard some concerns that perhaps Facebook Live is not functioning as it usually does. So we're doing our best to address those in real time. It is my honor to welcome and introduce the families who have stepped up to share their stories with us today. And as Stacy mentioned, there are 5 of them, and we're going to introduce each of them one by one. And so the first family I'll introduce is Rachel Nemhauser and her son, Nate. Go ahead and unmute yourselves and take it away.
Thank you so much, Jeremy, and thank you so much for having us. My name is Rachel Nemhauser, and this is my son, Nate. Want to say hi? Oh, he's feeling shy. Nate is 16 years old. He's about to be a sophomore at Interlake High School in Bellevue. And with his permission, I'll share with you that Nate's autistic, and he has an IEP and a behavior plan at school. Nate, can I ask you a couple questions? So people can see you. Do you like school? Yeah. What do you like about it? What do you like about it?
Yeah.
What? Do you like seeing your friends?
Yeah.
Yeah. Anything else that you want to share?
Uh-uh.
How did you like learning virtually last year? You got to sit up so people can see you. How did you like learning through the computer?
Uh-uh.
No, you don't like it? Do you like going to school better?
Mm.
Yeah. Okay. Nate is an awesome kid. He's charming, he's funny, he's smart. He's a total troublemaker, as I'm sure he'll show while I'm speaking. Before the COVID-19 closures, he was having an amazing freshman year of high school. He was doing assignments independently, successfully working in the school store without support, and making steady progress on his academic goals. When school closed in March, it was devastating for us. Even with a teacher and an IEP team who went above and beyond trying to help, Nate was not able to access virtual learning. The assignments were not things he could do without direct in-person support by a trained professional. When I attempted to teach him myself, he was fidgety to the point of being aggressive. He destroyed the OT tools and reading materials that the school had provided almost as soon as they arrived in our home. Distance learning just wasn't effective for him. Additionally, without the consistent access of school, behavior support, and IEP accommodations, Nate's behavior and mental health degraded substantially. Within a month of school closing, Nate's pica had flared so significantly that had COVID-19 not made our hospitals unsafe, it would have likely resulted in a hospitalization. Instead, it led to severe stomach pain and vomiting. Nate needs more than what he was provided last spring. He needs his behavior support, his IEP accommodations, and his individualized curriculum. He needs compensatory education to make up for what he did not receive. He needs for the state to recognize that virtual learning will not work for him, and that his individual learning and safety needs require that he be at school. He needs extra consideration, and he needs more than the average student in order to receive a free and appropriate public education. Nate deserves it. He needs it. He's entitled to it. And believe me when I tell you he's worth it. Nate, is there anything else you want to say?
Yeah.
You want to say thank you?
Yeah.
Yeah, okay. Thank you so much from both of us for listening.
Thank you very much, Rachel and Nate, for sharing your story. Next, I'm going to welcome and introduce Dana Protonentis from Seattle to share a little bit about what they're experiencing. Dana, I wanted to let you know that you're still on mute.
Okay, got it. Sorry about that. Zoom land, goodness. Thank you for your time this morning. My name is Adana. I am the parent of 2 kids, Langston, who is 10 and a rising 4th grader, and Aurelia, who is 8.5 and a rising 3rd grader. And for our family, sitting at the intersection of race and disability, this topic today is especially salient and important and weighty. We have had a really challenging time accessing a free and appropriate public education in Seattle. We tried with developmental preschool when Langston was 3, right after he was diagnosed with autism, and quickly experienced, frankly, trauma. He was, one of the paraeducators decided to try to toilet train him without our consent or permission in a way that was traumatic for him and did not respect his bodily autonomy. We had a teacher who was overwhelmed and not terribly experienced, who would just shrug her shoulders and say she just didn't have time to accommodate provide the accommodations from Langston's IEP. So we decided we would take a break, and we did private preschool, and then we tried again for kindergarten. And then in kindergarten, we did to get ready for kindergarten, we did our evaluation process. We sat down for our IEP meeting, and it was so contentious and so adversarial. And the answer to every request was no to an inclusive setting, no to a variety of different supports that were all suggested by Langston's therapist. And I will never forget this sentence when I asked the kindergarten teacher across the table from me why her answer to everything was no. She said, "I am not legally obligated to offer your child the best education I can. I'm obligated to offer him an adequate education." And I don't know about you, but my mama taught me to never accept a seat at a table where love is not being served. And love was not being served from Seattle Public Schools. And justice was not being served. And justice is what love looks like in public, right? So we had 3 choices. We could accept these terms. We could, this was Bailey Gatzard Elementary. We could accept these terms. We could lawyer up and fight back like so many parents have to do in Seattle Public Schools, or we could go to private school. And my husband and I decided the easiest thing was for us each to take on a second job and pay $22,000 a year in private school tuition to get our kids' needs met. And that broke my heart because I'm very proud to be the product of a public school education. I never expected to send my kid to private school. That just wasn't what we wanted to do, but it's what we had to do. So fast forward to COVID, when the world fell apart and we had to go to online learning. And my baby boy, who has worked so hard to gain all of his amazing skills over the years. My goodness, he has an autism diagnosis. He has anxiety. He has sensory processing disorder. He has obsessive compulsive disorder. Life is rough. And he meets it all with grace and a smile and a sense of humor. And his world is shrinking to the size of our house. That's it. You know, he is just a kid who really needs the opportunity to practice and to build these muscles in person with his peers in order to thrive, in order to hang on to these skills that he's worked so hard for, in order to build a world that's bigger for him. He has no opportunity to practice being in novel situations and managing the anxiety that comes with it. He has no opportunity to practice managing his OCD triggers in a classroom setting. Avoidance is so easy because all he has to do is tap the leave meeting button on that Zoom meeting, and then he can get away from the uncomfortable content of a story that's a little scary or a kid who's doing something that triggers his sensory issues. The only way that we can manage that, my husband and I, is to sit next to him to facilitate his access to online learning. And so then what happens to those 4 jobs that we're working between the 2 of us, right? When are we supposed to work? We have to do the job of being a teacher. And so what that looks like for our family right now is that our daughter is profoundly neglected, frankly, because it takes so much hands-on support for Langston. And that my husband's workday now starts at 4 in the morning so that he can build in time to take breaks so that he can help our son access school throughout the day as we're juggling things. And my workday now happens overnight. So 3 nights a week, I don't sleep. I do all my jobs. And I'm in grad school at the same time. It's brutal. And it's not just that our son is regressing, which breaks my heart because he works so hard, but also that our family's physical and mental health is degrading rapidly because we are so overextended and we really need a better solution. Thank you so much.
Thank you, Adana, so much for sharing your story with us, and completely echo all of the comments that have been coming through the chat box. Next, it's my great pleasure to introduce you to Jennifer Lee from Spokane, who's going to share a piece of her story with us. So Jennifer, you can go ahead and turn on your video.
Hi, hold on. Okay, there we go. Hi, I'm Jennifer Lee. This is my daughter, Angie. I also have a son, Tyler, who both receive special ed services. My daughter is nonverbal. She uses sign language to communicate and an iPad program that she uses to communicate. She has significant delays in most of her content classes. My son has speech, a little bit of speech delay still, but he also receives services for most of his content classes as well. And a lot of our issues this last half a year was in trying to, with her at least, was trying to get her to stay engaged. I have a master's in teaching, and I still wasn't able to get her to stay engaged in the content. Part of it was because when she would do the Zoom meetings with her class, she's in gen ed and does a lot of pull out for other things, but she was having a hard time staying engaged because it was so far above her head that eventually we just stopped going to her classroom meetings and Zoom meetings because it just wasn't doing her any good. The math was at 5th grade level and she was at 1st grade level. And so it just wasn't helpful for her at all. And then the few Zoom meetings that she had with her one-on-one aide that does sign language with her were awesome. And we loved those, and she learned a lot with them. And those, twice a week, half-hour lessons were awesome. But I mean, again, that's only 2 half-hour lessons a week. So it wasn't enough to help her, stay on task or stay at her level. I mean, she did learn more signs, but she wasn't able to access it as much as she would have if she would have been in class all day with the one-on-one aide. And the aide had only been with her for maybe 2 or 3 months prior to COVID happening. But in those 2 or 3 months, she had accessed a lot more sign language, was able to do a lot more things than she was in the years prior when they sort of refused to do her sign language in class and only wanted her to use the iPad, which was really difficult for her because she's not able to read. So trying to access this iPad that had, she had to be able to read for and, push the buttons that said the correct words was difficult because she, again, wasn't able to read the words. And the pictures weren't always as easy to understand or easy to know if this was book or learn, so that part was difficult. But when she had her one-on-one aide as of December through March, she was able to do so much more. So without her having that one-on-one aide, it was super difficult for her to stay engaged and to be able to communicate as well. Her aide is wonderful and has, tried to do things with us outside of the half-hour Zoom meetings that we were having twice a week. And that was amazing and was not anything that the school was requiring her to do. But again, it wasn't enough. And then for my son, he is in a charter school, and the whole school is learning Spanish. And he struggles with English, so Spanish, of course, is difficult. And he's only in 7th grade. He was only in 7th grade. So it wasn't a requirement by the state to have him in Spanish. And for me to try to teach him Spanish when it's been 15 or 20 years since I took Spanish myself was extremely difficult. He probably worked twice as long on that class as he did all of his others. And he still barely got a C out of the class at the end of the year. So that was probably the most difficult thing for him. The other thing for him is he does better when he has smaller group instruction, because he can kind of listen to other people, and he did great with me, and he didn't have issues finishing the work. He just really, he wants to do well, and he wants to get good grades and do everything he can to get good grades, and he works really hard at it, but he isn't always able to do that if he doesn't have a couple other people there to kind of talk things through and work things through with them. So having it just one student in the class was difficult for him. I think that's about it.
Thank you, Jennifer. We
Yes.
so appreciate you sharing that story. We know it's not easy to share this, especially in such a big crowd, but we really appreciate it. We're next going to turn our attention and introduce Maria Mendoza from Lake Stevens so that she can share some of her story with us. So Maria, you can go ahead and unmute yourself and turn on your video.
Hi, everybody. Thanks, Jeremy. So my name is Maria Mendoza. I'm in the Lake Stevens School District. My daughter just transitioned this last school year from the Edmond School District. Her name is Anna, and my daughter is 17 years old. She is nonverbal. On top of that, she has very challenging behaviors with her severe autism. On top of that, she's diabetic. So we have, as with everybody else, I'm sure, have struggled with advocating for their children with the schools. I know I have for so many years, and just even moving from school to school, from teacher to teacher, it's kind of like a restart every single time, and it's a new fight with the school to supply her all the tools that she needs to be successful. So my daughter absolutely loves school. She thrives from the structure and the routine that comes with school, not to mention the additional therapies that are provided with the school. She was doing great. She sleeps better during the school year because she has structure and routine. When COVID hit, her aggression went up. We got to the point where she caved in all 4 walls of her bedroom, where she spends the most time at. As you know, we've all, I'm also a single parent, by the way, have been for about 7 years. And I also have a full-time career. So it's been pretty busy. And when COVID hit, I also have obviously experienced the partial furloughs and so on with our industry. And I wanted to add that Anna has had, after fighting for so many years to get a one-on-one through the school, she finally got it at the beginning of this last school year. what was shocking for me was that when COVID hit and school closures happened, nobody reached out about meeting her IEP. We were offered Zoom meetings with her teacher once a week. And we had a couple of those. Anna currently has a behavioral team that works with her and comes here 3 days a week. And that she's had that for about a year now. They have been a great help and support system. Unfortunately, they're only here for a few hours of the day, and it's not their responsibility to provide learning tools and so on for Anna. And the virtual calls seem to not help my daughter at all. Like I said, she's nonverbal, so it was more of a nice touch for her to be able to see her teacher. And I wanted to add that the teachers and the paraeducators try their hardest to support our kids. I think what it is, it comes from above them. And a lot of times they don't have or they can't provide the tools that they would like to help our kiddos. So anyhow, I wanted to add that there, besides the Zoom calls, you know, it's been really tough on my daughter. And I'd have her on this call, but she's currently working with her behavioral technician right now. Anyhow, moving forward, I have had very little communication from the school since then. I see many emails to the general public about virtual education and what it's going to look like, and all the tools that are being provided for all the typical kids, but nothing that addresses how they're going to support or how they're going to meet our IEPs for our kids. So I have already reached out to the directors of the school district, and I have a call with them later today, but I want to address how I don't understand why, although there's one-on-one added on her IEP, why that hasn't happened yet. And my goal, and our kids deserve to go to school in person. They need it and they thrive from it. And it's especially for our higher impacted kids. And I'm willing to work hard and advocate to ensure that she gets in-person learning or one-on-one to come out to our home as soon as school starts. So just wanted to share how difficult it has been for us. I mean, I can show pictures and I can be more visual, but I think that, you know, just being a single parent and having a full-time job and struggling to keep my job in this industry. And then just on top of that, not being able to support my daughter as far as providing those learning tools. And I'm not having somebody else to be here to be able to provide that for her. She's not sleeping hardly anymore. And I think it's just due to the structure, you know, this routine of being home every day, I think is starting to become her norm, and it shouldn't be. One more thing I wanted to add was, yeah, I think that's it. I don't know what else
That's
I can.
great, Maria. Thank you so much. There have been so many messages of support and encouragement coming in, and we agree that not only are you and the other families incredibly strong, but also your experiences reflect those of so many others around the state. So thank you, Maria. We're going to introduce our last family who's going to share with us before we transition into a question and answer portion, and that is Emily Everett from Everett. So Emily, you can go ahead and turn on your video and sound.
Hi, I'm Emily Everett. I'm from Everett, and we're in the Everett School District. I have 3 children, Elizabeth, who's 8, Solomon, who is 5, and Wally, who's 2.5. My 2 boys are both diagnosed with autism. They are going to be starting developmental kindergarten in the fall and developmental preschool this fall. Today I'm going to focus on Solomon, my son, who's going to be in kindergarten, because I had experiences with him in the transition from being in school to having to have everything shut down, and then just like my concerns for the fall. Solomon, prior to everything shutting down, he loved school so much. He was receiving outside services of ABA and speech, but then in school he was also getting occupational therapy and speech services. He was thriving. His language and vocabulary was just expanding, and it was incredible to see his excitement to learn. When things shut down so abruptly, it really rocked his little world. He went from wanting to go to school every day to having it be a constant battle to try to get him to do the work and stay on task in our home. We had 2 Zooms a week. Each Zoom would range from 15 to 30 minutes. They'd be motor, where we'd have to do activities, or we'd have to do reading and have them read a story. And it was heartbreaking because I saw my son, who loved to learn and is very inspired by learning and books and reading, just to be a pile on the floor crying. And as a mom, it was heartbreaking seeing that. I want what's best for him and all of my children, and seeing that hinder his learning and all of the progress that he's made, it was really rough, including the fact that he had lost all of his services with the shutdown. And it was just really hard. My preschooler in the fall, he has done birth to 3 services with speech and occupational therapy online with Zoom, and that's been just me constantly chasing him around the house, trying to make sure that he can stay engaged. And it's just been really rough. My biggest concern, like in terms of the fall, is just like the impact that this will have on their education and their development. I felt like I lost my community of teachers and specialists when everything shut down, and that it was just very isolating. And I just want to make sure that my sons have access to meaningful and impactful education. With what we've experienced in the spring, it wasn't great. And so all I can hope for is just an improvement. Yeah, so just thanks for listening for my family's experience.
Thank you, Emily, so much. We're so grateful to all the families who have shared today. It's really hard to share your personal stories with Facebook and Zoom and the state superintendent and a lot of strangers, and we're very grateful. Chris and Glenna, this is kind of the question and answer part, and I'm very, you've heard clearly that there are some pretty significant challenges for families accessing special education. We know that there's no risk-free environment during a pandemic. We know that. We know that you're just working to look at how do we make schools safer and how do we provide for all of the students. Today, we're here though to hear from you both. How are we gonna do this when we know there are so many students who cannot benefit from remote learning? We need some innovative ways to reach these students in a variety of ways. And I'm just curious if you want to reflect for a minute on some of what you've heard.
Yeah, thank you very much. Just a huge thank you to our parents, Rachel and Adana and Jennifer, Maria, Emily, and your incredible kids. Thank you for sharing your story. It is hard. You are in the middle of a social media call with hundreds of people watching, and I think it's powerful, but also difficult. So thank you for your courage, and the community and the family, the network around the state has really responded. So for those of you who didn't get a chance to be in the chat, please do that to see just the incredible wraparound of love and support. The spring was a remarkable time in our country and the world. So every state shut down, 53 million US students were sent home, and all the states, 1.6 billion kids around the world lost in-person learning. So the public health crisis had an immediate impact across lots of sectors, and education was one of them. We know prior to COVID, the disproportionate impact of an education system that doesn't honor equity and justice all the time. And particularly for the students and families you just heard from, and a lot of you experience all the time, So I want to acknowledge that we're not starting from a place that has this amazing, perfect system and suddenly we lost it temporarily until we get back to it. It has underlying problems, not without incredibly compassionate educators and people putting their best foot forward. But I do want to contextualize the fact that whatever we do to get through the next 6 months or year, it also has to be about a momentum and about addressing supports for families as we return, because they weren't always great then either. One really important point I want to make, just given the chat and what folks are talking a bit about, is how different the spring is from a regulatory standpoint. The governor shut down our schools last spring, and outside of almost narrow contemplation about life and safety, our buildings were closed. We could not deliver instructional support. That is not the case right now over the summer, and it is not the case in the fall. The governor's proclamation expired. And while he's put a health framework in place of high, medium, and low risk counties, and districts are honoring that, and most of them are going remote, there is no prohibition right now about using our facilities to support students when districts in partnership with families determine that they cannot receive an adequate education through remote means. Now, that's not to say that it's easy, because a lot of you still have significant health concerns, but I think there's an overwhelming predominance of opinion that for students who really need high-touch services and therapies and supports that can't be effectively accommodated through a remote model, you have a want to either revisit the IEP or to keep it in its place and acknowledge it through the supports necessary in person, which I want to make clear, our facilities are open for that. So families have to work in a very personal way with their school district and their teams and their local building administrators and their teachers to navigate those options. Can therapies and supports be brought into the home remotely? Can they be brought there in person? Can they be done in the building? I just want to be abundantly clear that what we established this year for a framework and the vast amounts of guidance that we have sent to the system around this issue for administrators and teachers is about trying to recognize and honor the law. No diminution, no diminishing of the expectation of the legal rights for families and students with respect to FAPE. It's a matter of how do you build that custom solution that really recognizes the individual needs of kids. And it can happen in our buildings. So I think it's critical that you continue the work that you are doing to contact your individual school, because the expectation of delivery is there, the resources are flowing there, and the opportunity to be in buildings is there. But again, there's a health framework that is absolutely not negotiable from public health. Physical distancing, hand hygiene, screening and cleaning, face coverings. There are clearly some exceptions they've written about that for students who need to see mouth movements and need to see in therapies their teacher or instructor or support staff's face. So there's some accommodations that can occur there. But it's really important that folks translate this passion and this very obvious dissonance between a model that does not work for families with an opportunity to make it better this year. But it is a high-touch advocacy effort. We've put the policy in place, the resources in place, the governor's created the opportunity for our buildings to be available. And now each local community is figuring out their plans generally in terms of reopening and how they will support families that need additional supports that remote learning just isn't going to accommodate. So let's continue. Glenna may have comment, but I want to make sure we understand kind of the framework about what's possible out there. And then we'll continue to take some questions here.
Thank you, Chris. And Glenna, you've been so great about answering some questions in the chat. I'm wondering if you could talk a little bit more about, for those families who may need it, they are understanding the risk and the safety precautions, and how do they go about approaching this? We've talked about the fact that this going into the fall, we're looking at IEP and progress measurement, not a continuous learning plan. And then on a case-by-case basis, some students could receive in person. So how do families go about approaching their IEP team in their district about this?
So I would recommend that families contact their special ed teacher / case manager, the person who's been holding their IEP. meetings and potentially the special ed director of the local district. We have districts that are in various stages of coming back to start school. And one of the things we need to remember is that not all teachers are on contract yet. And so I would include both your special ed teacher and your special ed director, just in case that impacts you, and request an IEP meeting to go over the IEP that's in place for the fall, which would have been the pre-COVID IEP, generally speaking, as well as the progress monitoring data that was collected during spring. One of the things that we want to make sure is that everybody understands students with disabilities remain entitled to FAPE. And as the superintendent said, that FAPE entitlement shifted slightly during the spring. It was an emergent situation, the beginning of a pandemic, and there was not adequate PPE at that time that schools could access to provide in-person services. However, that's not the case as we go into fall. At this time, there's PPE. We have guidance out from the Department of Health that is more defined, and there is some additional funding through the ESSERS part of the CARES Act that can be addressed or can be used to address some of these gaps. So what this means is that not every student with a disability is going to be brought back for in-person services. However, students who were not able to access or benefit from remote instruction previously should have an IEP team that considers the services that are needed. And that's going to be the first step of the process, is meeting with that IEP team.
Thank you very much, Glenna, for sharing. This is Jeremy Norton Paul again, and we have been getting so many great questions in the Q&A box. And so just what we're going to do is we're going to hopefully get to a couple more of them, but we're also going to, at the end of this recording, be able to pull all of the questions and work to provide some information and answers to these questions. And we'll figure out a way to get that information back out to folks, probably through our website and Facebook page. So I just want to let everyone know that even though we can't get to all the questions, that we're seeing them and we're hearing them, and they're all very important. So I'm looking at the box here, and I guess, and actually, you know, Stacy, as I'm looking through these questions, are there any questions that you had written down that you want to, from the box here, that you want to pose to Glenna while I'm looking through this list?
Yeah, I mean, I think that people are very anxious to understand if their child is not making progress and is not able to access the services that they need. Right now, the feedback that we're getting from so many families and comments in the chat, even from teachers, there's still a lot of I don't knows. Teachers don't know, therapists don't know, districts aren't sure how to approach this, and it is understandable on some level. And yet I know we're getting a lot of comments here that say, but we went through this in the spring, we've had the summer to plan, we know teachers are going through in-service and instruction right now. How, you know, what's reasonable in terms of waiting to see how this goes, and what sort of maybe support and enforcement can OSPI provide when families find themselves just hearing, I don't know?
Superintendent, do you want me to lead off with this one, or?
Yeah, and I may follow up with kind of where we are in the curves right now and what's caused districts to respond so late. But go ahead.
Great. So IDA is very specific in that it requires that an IEP be current and be implemented on the first day of school. So as we're going into getting ready for school districts to start, they're still making last minute decisions. They're having to revise plans due to the COVID rates in their area. School boards are having to make decisions. And we would expect to see potentially those changes happening as we start school, and even potentially once school starts, due to the evolving situation. That's why I encourage people, when they write to their special ed teacher to also include the special ed director, who has likely been involved in more conversations at the district level and can help guide that information, as well as provide a timeline. We know that everybody is anxious when information is not available, whether it's students, whether it's families, whether it's educators themselves. There's quite a bit of information that's already available, though, that's out there that people may have missed. When I answered one of the questions, I dropped in the link to the OSPI website that has all of our COVID guidance. We also have just released a parent summary that's being translated into 11 different languages around guidance specifically for students with disabilities. One of the things that I think is most helpful is to remember that, again, we are all working on this together. And so educators who are nervous, who are learning things along at the same time as parents and families, it's really an opportunity to sit down and keep the student needs centered. Remember that we're in a very different place than we were in the spring. And there's an expectation that any remote instruction is done to a different level. And the guidance from OSPI talks about that. We've called it Continuous Learning 2.0. So there's also rules out there about instructional hours that define the amount of school day, the length of the school day, and instructional services. So while we know that many people are frustrated over what occurred in the spring, there is definitely a different expectation going into the fall regarding FAPE. Start locally, start with your team, start with the people who know your student best. Look at the data, whether the student made progress or didn't make progress, and then identify what is needed specifically for your child. Again, it may not be in-person services. It's going to be very student specific. It's going to look at whether they could access remote instruction, the safety requirements of both the staff involved as well as the student who may have health considerations. But the Department of Health has put out great guidance that has reminded us that students, that it's fairly low risk if students are wearing face coverings, if students and staff are maintaining 6 feet of physical distancing, or if there's brief intermittent contact. And brief is, generally speaking, less than 15 minutes. And so that is, again, more specific guidance than we had this spring. And districts are looking at how they could provide in-person services safely when they're needed for FAPE.
Great, thanks, Glenna. That's great guidance and information. And Chris, I know that in starting to close this off, you know, the obvious question, and when we're seeing it in the chat and the Q&A is, you know, so a lot of childcares are opening, YMCAs are having camps, people are paying to send their kids to private schools that are opening. You know, how do we reconcile that with what we might be able to help schools do safely in smaller groups, particularly for this group of students that's so vulnerable? And what kind of closing comments do you have about giving us some hope around these issues?
Thank you, Stacy. Again, this is a global pandemic, and it's been very, very painful across the board. The guidance that Department of Health has put out for early learning facilities, childcare facilities, is very consistent with our public school system, public and private. So the protocols that you see in those places, face coverings and hand washing and physical distancing, they've got to follow all of that. I think what Department of Health would tell you, and again, I'm not a public health expert, we followed their lead on this, is those are generally small settings. And so for purposes of contact tracing and cohorting, they have a much better possibility at success, which is why health has been much less excited about opening our schools to in-person work, because our average building has 500 students. And even if we cut that in half through flexible hybrid scheduling, it's 250 students. And so the probabilities are exponential for spread of the virus to all populations, but certainly medically fragile populations and at-risk employees and students. And so I do know in the public health world, they think quite differently about early learning than they do our students. And then there's an age reality here. Birth to 5, there is some pretty clear, I think, epidemiology about them being a bit more resilient here, but obviously safety is our priority and less likely to spread versus middle and high school students. There's now plenty of evidence that even though they're not quite as impacted as adults from their personal health impacts, they are just as likely or more likely to spread the virus. So there's been really good questions about why early learning facilities are not public schools, and a lot of it has to do with the inability to cohort in schools very effectively, the volumes of students, and the transmissibility of our middle and high schoolers in particular. And then the other hard part is our very young people tend to have a lot more supervision by parents and families once they leave the school setting. So we've got them in for 6 or 7 hours, and then for 17 hours of the day, there's got to be a health and safety protocol. I think for really young learners, that's easier to do because parents have a lot of control over their movements. By the time we get to a lot of our late elementary, middle, and high school students, they are still demonstrating stunning volumes of mobility in our communities. And that's becoming a big problem. So again, we developed a plan to open our schools, and we know how to do that. That's why all the planning we did in April and May was about reopening schools, and we announced that we're reopening, and the caseloads look great, and the mortalities were coming down, and hospitalizations were way down. And then come July and through August, it's just exploded upward again. So it's my way of telling you that our goal was to open schools because we think it's the best setting. That would have accommodated a lot of the interests and needs of families who are here. But unfortunately, the caseloads are up, and we don't control that. The public health folks have told us there's a framework they want us to follow, and so they've effectively got schools shut. Although I will say our buildings are available for the small settings and individual one-to-one supports, and so that's that localized piece again. I know folks are frustrated. I am frustrated. I have 2 kids, and I said on camera a while back, I feel confident enough in our safety protocols to put my kids in public school. I do. And that's made me stunningly unpopular with people who think we should have schools closed. And I hear from a lot of families who say public school is the option and private school is the option, and we need to get kids in there. And then I get a subsequent email that says, why are you possibly putting the lives of people at risk by sending them to school? And we've talked to families who say, I would definitely send my kids back as long as the safety protocols were in place. And then about 10 or 15% of families, based on our work, tell us that they think it's ridiculous that any kid should have to wear a face covering in school. So this is tough. It is really, really tough emotionally. I think it is virtually impossible to provide the kind of education we want in the setting that we are in. But I would just ask folks to continue to show compassion for your local school district, but high expectations for service for your family and for your student. There is a FAPE framework in place. There's no diminishing the positive civil right that is, and we expect students to be served, and our buildings are open if that is the only way it can be done, and our professionals know how to do that work, and they have an expectation to work with you on what that looks like in your community and for your family. So we'll continue to have that expectation for districts. We'll do everything we can to get the money flowing to them. There are districts who are already in some financial struggles because as they lose students, they will lose resources. That is just part of the formulas that the legislature has produced. So again, I want to thank you for being on this. As you might imagine, I'm with groups all over the state every day trying to try to figure out positive solutions, and they're not easy to come by. And for all of the understandable frustration at the state level, and you want us to make districts do some things, I want to take that criticism, and I accept that. I also really, really hope you will take to heart, as most of you do, that at the end of the day, staff in Olympia is not going to make a one-to-one relationship work locally. That is really, really incumbent upon families and local educators to make that connection. So have high expectations of your districts and keep pushing.
Thank you so much. And I think you've hit the nail on the head how complex this problem is with your comments and feedback. And Glenna, you both provided us a lot of good answers. I think if my tech support could put up the next slide, we might just summarize just for a minute some of the things I think we've heard. And most importantly, that there's no risk-free environment during a pandemic. And schools are really just working hard with protocols to make them safer, but that we can do that. That school districts are scrambling right now to really put together their plans and answer some of these important questions I think we heard today. That for these families listening today and the teachers that are here, and we're grateful for the educators that have attended, the IEP is really the focus. We are not looking at continuous learning plans anymore. And families need to be revisiting those plans with their teachers. The FAPE is the standard, so families should be expecting that interventions will be occurring, that you will work creatively with your IEP teams to make sure that interventions are happening and that progress should be documented. So you should expect that level of movement in your child's learning. That on a case-by-case basis, students may receive in-person instruction. And again, the IEP team is the key. So you families, advocacy is definitely our thing. If you're one of the over 1,000 people who are interested in this webinar today, in our community, we're very used to having to advocate, and it is not going to change. So I'm sending a lot of, as Dana pointed out, love, support to all of you. If you'll do the next slide, please. We want to make sure that you know that some of the resources Glenna and Chris provided are on their website at OSPI, and these are the links. Our Facebook page, our websites, both the Developmental Disabilities Council and the ARC will have these posted. And if you need help, informal help just talking through things, you can contact either the Developmental Disabilities Council or the ARC. You also have a very important statewide resource in the Office of the Education Ombuds. And there is a liaison at OSPI for special education families. And if you reach a point with your school district or you want to try to maybe mediate out some more formal concerns, you can certainly contact Sound Options Mediation. And the next slide, please. These are ways that if you just cannot work it out any other way, that you can file a formal complaint. And we always want to make sure that you know how to do that. Certainly, as Glenna said, and Chris has reinforced, this all starts at the local level. And it's about the relationships and the communication you have with your individual teacher, IEP team, your school principal first, your school district, and then reach out for more help if you're not getting what you need and you feel stuck. We're certainly here to help. I know we could be here longer. I hope that Chris and Glenna, if we need you, we can do another one of these as school gets further into progress. We want to thank both of you for your very valuable time. We especially want to thank our parent speakers and their students. And probably most importantly, poor Crystal. I think your hands must be getting very tired now, but we're so grateful for you and for being here, and to our transcriber, Brian, who I don't see on right now. And for your patience, larger community, and our figuring out all of our accessibility. Chris, I can see you're back on. I don't know if you want to end us, but thank you again so much, both of you.
Just a thank you to the ARC for hosting this and for everyone's engagement. Thank you.
Great, thank you.
Thank you for listening.
And we'll have this posted by tomorrow, hopefully. It's recorded, and we'll talk with all of you again soon.